Hello there. Today we are going to start with Comp of the News. So last week we talked about the Family First Coronavirus Response Act, and then on Friday the Senate passed and the President signed the CARES Act. So we're going to talk a lot about those things today. So we're going to start first with the economic condition, right? Get our big picture in, some things that are going on in the news in general, and then a few slides around the very specific law. So the first thing you can see here is it is not good in terms of employment for huge industries and sectors of our economy. So last week, or the week ending March 21st, unemployment benefits were sought by 3.3 million people, and that's expected to go up this week when it gets recorded. The industries primarily are transportation, restaurant, hospitality, which you would expect. People aren't traveling, so they're not staying anywhere. They're not supposed to be gathering in large groups, so the restaurant industry is being hurt a lot. Everybody that supports that industry, so anybody that provides food or cleaning services or anything else that goes into these industries is also getting hurt. Today, major retailers have laid off or furloughed 80% or more of their workforce. So it is very devastating to a large number of our population. On one way that a company is trying to deal with this is General Motors is temporarily cutting the pay of its 690,000 workers by 20%. So instead of furloughing them or laying them off, they're reducing that pay. And that includes for executives. The executives' pay is also being reduced. And they're pledging to pay it back with interest no later than March 15th, 2020. So that's really a positive thing, I think, that a company is trying to do. Plus, GM and Ford are also using their manufacturing resources to start making ventilators that hospitals are needing to service those people who have COVID-19. Health insurers. There are a few health insurance companies that are also trying to help, because if you've watched the news, what we are trying to do is to reduce the curve. So we want fewer and fewer people to be infected because that's really taxing our healthcare system. So we want people to get tested. We want them to know. We want them to be treated. But if people don't have money, they don't want to go to the doctor, and then they're going to continue to go to work or whatever they need to do to make money. So three major health insurance companies, Cigna and Humana, on the one end, announced yesterday that they would waive consumer costs associated with treatment. So already when we get into the CARES Act, you'll see that the testing, everything related to testing, is going to be paid, no cost sharing, meaning that the employee or the individual won't have to pay anything. But what these people are talking about is even hospital stays. So Cigna and Humana will help to cover that, but that is for people who have their insurance. All right, so they won't have to, those employees or people that have Cigna or Humana healthcare won't have to pay deductibles or co-payments. And then last week, Aetna also said that they would waive costs to patients' hospital admissions related to the coronavirus. So there are companies that are trying to help overall. So the Coronavirus Aid, Relief, and Economic Securities Act supplements or amends the FFCRA that we talked about last week. And it is more focused on economic stimulus. So a couple of the things that it covers are important provisions that the Society for Human Resource Management has championed for quite some time. One is modernizing HSA rules, and we'll get to that in a couple of chapters, but basically those are whenever you have monies that you pay in pre-tax and you're able to use that money to pay for health services. But in the past, it hadn't included telehealth. So that's what I want to focus on right now. So for this, it's the telehealth that is being included that your HSA can pay for that before you even reach your deductible. Because again, we'll cover this later, but HSAs are used with high deductible health plans. They're also, you can also use those HSAs to cover certain over-the-counter medical products that are not prescribed to you by a doctor. So that's a change. And the second one has to do with education. Right now, a lot of people are graduating from college with a lot of college debt, and their employers haven't really been able to help as much as they would like to in this front, although some employers are trying to be very creative with helping their employees. But this very specifically says that an employer may, and it's an option, may contribute up to $52.50 annually toward an employee's student loans, and that would be tax-free, which is good. Next, the big things that came out of the CARES Act that affects every single person in the United States. So every individual that paid taxes in 2018 will get a check for $1,200, and parents will receive $500 for each child under the age of 17. Now this is phased, so if you make more than $75,000, then you don't get the full $1,200, and if you make more than $99,000, you don't get anything. But this is designed to help those people who really need help. And they're saying that this is going to hit people's, either their bank account or their mailbox within 3 weeks. Unemployment insurance. So we just talked about how 3.3 million people had signed up last week for unemployment. Well, that is something else that we'll talk about, but it's a joint organization between the federal government and the states, but the states really run it. And in this case, now what we're saying with this CARE Act is that furloughed workers are going to get whatever amount the state usually provides for unemployment, plus an additional $600 per week, okay? And that will be extended for 4 months for people who continue to be unemployed. A huge deal for this is that people who are self-employed, who are gig workers, are also allowed to sign up for unemployment. This has not been the case in the past. And again, all these things are related to COVID-19. So they are going to go from April 1st to December 31st. Some things may stick, other things will go away. In this class, we're trying to focus more on the employer, right? And how the employer uses compensation strategically. So in this, this act says is that small businesses will be able to take out loans and be paid back for making payroll. This federal government wants employees to keep getting paid. They want employers to hold on to their employees. So you get this tax credit as an employer. And these are, again, those employers less than 500 employees. But you're going to get a tax credit if you hold on to at least 90% of your employees. So they're really wanting companies to work to help their employees in any way that they can in terms of payroll. So all this is very confusing because, again, it just got put into law on Friday, and already SHRM's had webinars. They have a fact guide, FAQs that I'll put out on our Blackboard site, but also the IRS is providing guidance. So this is from what we learned last week in the Families First Act, and that has to do with paid sick leave. So paid sick leave is going to be different from the Family Medical Leave Act amendment. So paid sick leave is more around the Fair Labor Standards Act, which we had talked about. And so they want to be very clear on how the federal government is expecting employers to pay their workers if for any COVID-19 related reasons. So that's that 80 hours of paid sick that we talked about last week. And as an employer, those employers are going to get 100% reimbursement for that paid leave pursuant to the Act. For any health insurance costs, employers aren't going to face payroll tax liability. The self-employed, again, this is a big deal. Self-employed individuals are also going to receive credit. And it's going to be fairly immediate because the way they're doing it is they're not issuing a loan. Instead, they're saying you don't have to pay your taxes. You don't have to pay those payroll taxes. So, as you can see in this example from the IRS guidance, if an eligible employer pays $5,000 in sick leave and is otherwise required to deposit $8,000 in payroll taxes, then the employer can use up to $5,000 of their $8,000 taxes to pay for that. So it's basically they're paying themselves that loan. And then the employer would only be required under the law to deposit the remaining $3,000 in taxes at the next regularly scheduled time. The second bullet says that if that eligible employer has to pay $10,000 in sick leave, then they only are getting $8,000 in payroll taxes, then the employer could use the entire $8,000 to make those qualified leave payments, and then would request a credit for the remaining $2,000, and that's that fast credit that the government is willing to provide. The last thing I want to talk about is retirement. So the coronavirus has really affected our economy. It's affected the stock market. Stocks are going up and down. Things are very volatile. So for anybody who has a 401k and they have any money in the stock market, that is really affecting their retirement. So not only do our senior citizens face additional health risks because they're more vulnerable, they are also more vulnerable in terms of their retirement. So this really shows how important it is to plan for retirement as best you can and adjust your plan as you proceed. There are very few pension plans anymore, pension plans being that defined benefit plan versus the defined contribution, which is the 401k. But those 401ks are very vulnerable in a volatile economy. And it also shows how important our Social Security system is. What's the last thing? The $2 trillion coronavirus stimulus plan will allow Americans to tap into their retirement. So that is another thing. You can, if you have a 401k, you can actually borrow against it, or you can make emergency withdrawals. So there is a part of this act that makes it easier for people to take out money without penalty from their 401ks, and then they need to pay that back to themselves because you're basically taking a loan from yourself. You've got to pay that back within, I think, 2 years. So there is a lot going on in terms of compensation with this COVID-19 situation. Just want to keep you up to date. I hope all of you are safe and healthy, and I will be back shortly talking about Chapter 8. Thanks, bye.